Well, welcome to everyone who's joined us here live today for our 2023 Mom Congress Moms Agenda Bill Training. My name is Crystal McCauley. I'm your community director, and I'm very excited to be here with you all today to learn about the Healthy Moms and Babies Act. We have Katie joining us, Katie Collins joining us from G2G. Katie is going to introduce herself here in just a few minutes and be our bill trainer for today. Ebony, we welcome you as well. Nice to have you. Ebony's screen sharing today. I'll be dropping links in the chat as we go. And again, if you're joining us live, we invite you to use the chat feature to ask questions and or raise your hand if you'd like to ask a question live. And you can go ahead and go to the next slide, Ebony. So first, just a little bit of homework before we get started on your bill training today. We are here to learn about the Healthy Moms and Babies Act, which has a version in both the House and the Senate. The first thing we're going to invite you to do is click on the link that Ebony is going to open up, and I'm going to grab for you and drop into the chat. This will take you to HR. Whoops, excuse me, where are we here? Thank you. HR 4605, which is the House version of the Healthy Moms and Babies Act. We want you to have a look and see when you go over to the co-sponsors tab, is your House of Representatives member already listed as a co-sponsor? Chances are probably not. There's only 2 individuals listed on there currently. And then you can, excuse me, toggle back over to the slides, and we will do the same thing for the Senate. So S948 is the Senate version of this bill. I'm going to drop that in the chat right now too. Same thing, you can have a look at the bill text here, but if you go over to the co-sponsors tab, that is where you're going to find out if your senator is the only co-sponsor listed at this point in time, which is Senator Hassan. So take a moment to have a look, know where your legislators stand on this bill. And I will turn it over to Katie Collins and invite you to introduce yourself. Let us know about you and your role at G2G. Excited to have you here and also again with us tomorrow. So thanks for your time, Katie.
Yeah, of course. You get a couple of times with me this week. But hello, good afternoon, everybody. I think even if you're on the West Coast, it's the afternoon now. We're excited to be with you to talk about healthy moms and babies. As Crystal said, my name is Katie Collins. I am a vice president at G2G Consulting, where I work on health-related government affairs work kind of across the spectrum, but certainly with a focus on women's health. My background is actually in the cancer space. I spent 6 years in the Obama White House, first working for President Obama, and then concluding my time in the administration on the original iteration of then Vice President Biden's Cancer Moonshot Task Force, and continued on Team Biden for several years as the program director for the Biden Cancer Initiative before doing some advocacy for the National Institutes of Health, and then coming over to the G2G team. So that's a little bit about me. I am a Mom Congress member, maybe most importantly. I have 2 children. I have a 5-year-old boy and a 5-month-old baby girl. So I love Mom Congress and everything that this group does and how it brings us all together to advocate for these really important changes. So I want to talk a little bit about why healthy moms and babies, why this bill is important. And I'm sure for some folks on this call, all of these facts and figures are already familiar to you, but in case they're not, I just want to set the stage for why this is important. So again, as many of you may know, over the past decade, the birth rate in the US has been decreasing by about 20%. So women are having less babies than before. However, the maternal mortality rate is rising. So we have more moms dying, less babies being born. That doesn't seem right. Despite having one of the most advanced healthcare systems in the world, the US has the highest maternal mortality rate among developed nations. So that means if you look at the list of global mortality rates, it is riskier to have a baby than in Ukraine. It's riskier to have a baby than in Kazakhstan, than in Egypt. I think we make these assumptions that we are better off. We're going to get better healthcare in the United States. And if you're a mom, that's just unfortunately not the case. Maternal deaths actually rose 40% in 2021 compared to the year before, which is huge. So why is this happening? And this is because pregnant women are not receiving quality medical care. And racial and ethnic disparities mean that minority women's care is even further subpar. In 2021, the maternal mortality rate for Black women was over 2.5 times higher than for their white peers. These are crazy numbers to be saying out loud in 2023. In addition, we see C-section rates increasing, often for the wrong reasons, not necessarily for a medical reason, and they're doing more harm than good. Actually, non-essential C-sections currently account for 33% of births in the US. So a third of births happen by C-section compared to 15% globally. And the CDC has data that shows that 80% of pregnancy-related deaths are preventable. So that is why we need healthy moms and babies to prevent these deaths that we can prevent, and to really do better for women across the country, especially for minority women, and for women in rural areas. So I'm going to tell you a little bit about this bill. So this bill is bicameral and bipartisan, which means that there are bills in both the House and the Senate. Those are called companion bills when they're the same, and that they're led by both Republicans and Democrats. So this is a good thing. It gives the bill the highest chance of success, having both chambers and both parties involved. And this bill was created to respond to the maternal mortality crisis that I just talked about by increasing access to care and support during pregnancy, supporting pregnant moms with access to telehealth and other remote care features, and providing whole person care to the pregnant mom. So looking at all aspects of healthcare, not just going in and checking on, does the baby's heartbeat sound okay? And it also addresses gathering more data around social determinants of health to get at this disparities issue that I was referencing earlier. Okay, so what does that mean? How does it do this? What is actually in the bill? So I'm going to tell you a few things. This is not, I didn't want to read the bill text, but just pull out a few nuggets and explain why they're important. So I talked about improving access to care. So one thing that this does is it requires the Department of Health and Human Services, which is the federal agency that covers all health-related things in the federal government, to issue guidance to the states on community-based maternal health programs. So these are programs that exist, often, and well, really anywhere, as I say, in our cities, but also in rural areas that are funded by the county, funded by the state. Some examples from where I live in Cleveland, bring maternal care into the home, bring support groups together of new moms, sorts of things like this that get the community involved beyond just the doctor's office. It requires the Department of Health and Human Services to publish resources and strategies and share that information with maternal care providers to improve outcomes. It also requires the state Medicaid offices to report quality measures around maternal health. So they get reimbursed based on quality. So if those quality measures include maternal health, that should provide some additional motivations for good, strong maternal care in that state. It gives monies to the states for coordinated care programs, and it requires hospitals to report C-section rates. and establishes grant programs to go to the states to reduce C-section rates. So getting at some of that quality of care issues that we talked about earlier. And it also has a few provisions around expanding telehealth during pregnancy. So it has a pot of money that goes to the states for telehealth pilot programs with maternity care. And it also requires the Center for Medicare and Medicaid Services, CMS, requires them to give a report around remote monitoring and the impact it can have during pregnancy. So this is taking a look at how can women keep an eye on their vitals at home, and it differs depending on what type of care you need for your pregnancy. It could be monitoring glucose. If you have gestational diabetes, for me, when I was pregnant, I had some heart issues. So I actually was able to have some remote monitoring of my cardiac activity. So things like that, and what type of health impacts it has during pregnancy. So those are really the big ones, again, around improved care and access, bringing community programming into maternal care, and expanding telehealth use during pregnancy. And I want to pause there and see if we have any questions just about, those provisions in the bill, what it does, or some of those supporting facts. So when you're doing meetings with your legislators, and I can work with Crystal and Ebony if it's helpful to do like a blast of those facts to you so you have them, but to really showcase the dire situation that we have around maternal mortality. Sorry. Shamika has her hand up, so I'm going to ask you to go ahead and ask your question.
Yes, hello to everyone. So my question is, do we have something that holds maybe doctors accountable for maybe their biases and discriminations, like encouraging patients to fill out surveys and seeing how many times a certain doctor or a certain hospital is being reported or brought up in the reports, which I think should also, I think that's kind of important. I'm not sure, but that's my question. Do you have something like that already implemented into one of these bills?
So that is not in this bill. A lot of that reporting that you're talking about is happening at the state level. To be honest, I don't know the answer about physician specific reporting. But certainly I do believe that discrimination data is reported to the state. I'd have to do a little bit of homework on that one. But again, that data reporting would come at the state level. Now, I suppose there could be legislation in the future that could fund programming in that, certainly in the physician education space. But yeah, that's not necessarily a part of this bill, but a great point about, those outcomes being worse for minority women for sure, and why that happens. Crystal, I don't know if you had anything. Yeah, absolutely, Shamika, for sure. Crystal pulled this up, but I don't know if you have anything that you wanted to add.
No.
Otherwise, I'm happy to continue to take questions.
I was just going to say, does anybody else have questions? Ebony was just sharing that we have these two support documents here. So I'm going to drop these in the chat, and then I'll turn it back over to you, Katie, to carry on.
Sure. Okay, so no other questions. That's okay. If they come to you, feel free to raise your hand or just chime in. So what are we asking of you? Crystal touched on this, but we are asking you to ask your representative and your senators when you do these meetings to co-sponsor this bill. Co-sponsors are important. The more co-sponsors a bill has, the greater interest it shows, the greater likelihood it is for that bill to move. So we, as our goal as Mom Congress advocates when it comes to this legislation, is to get as many co-sponsors as possible from across, a vast array of geographies. So we want to show that this has national impact and that we have a large number of representatives and senators behind this bill. I think that folks said that those facts would be helpful, so we're going to blast those to you, and you share them with your legislator, with the staffer that you're meeting with. A lot of times they're going to be educated on this issue. Sometimes, not so much. Sometimes younger staff may not be as familiar. So you want to be sharing these data points. You'll leave behind your paper, and you'll ask for their support for this bill. Tamika, you have a question.
I do. I have a quick question. What have you found as some of the reasons why someone wouldn't co-sponsor a bill that's bipartisan?
Yeah, there can be a lot of reasons. They can stem from bandwidth in an office. Deciding that it's not something that they want to spend their time pushing forward, although being a co-sponsor does not necessarily mean that it's a huge time commitment. And it's also awareness. So there are a ton of bills that get introduced, every legislative week across the legislative calendar. And so a lot of times it's spotlighting what are the bills that are impactful. And that's exactly, I think, what we're trying to do here. And it's also showing constituent impact and constituent support. So that's why you're meeting with your legislator and your senator. It makes a huge difference for them to know, my rep is Chantel Brown. I'm in Cleveland, Ohio. So hi, Chantel, this is happening in Cleveland. This is impacting me, your voter, someone who votes for you, and others like me, and that's why we need you involved. So showing that constituent impact is really, really big. And that's exactly what you're doing by having these meetings. I see some questions in the chat. Okay.
Thank you.
Looking at perceived discrimination and Ebony chiming in. Perfect. Okay. Tamika, did that answer your question?
Yes. Thank you.
Yeah, and again, the bipartisan support, unfortunately in today's fragmented times, what having, both a Republican and a Democrat on there to start with shows is, this is something that both parties are getting behind. So whether you're meeting with a Dem or an R, you're able to say, we already have somebody from your party on here, which also likely means that there's nothing incredibly objectionable hopefully for either party.
Katie, I'm going to ask a question of you. So we've had this conversation a couple times where offices will ask specifically, are there any financial implications on this bill? Or is there any, some people that's their sticky wicket, is their cost involved. That's exactly what Heather just put. So we're on the same wavelength, Heather.
Yes. And this, to me, those cost bills are often when you are expanding a service. So if we were going to them and saying, we want CMS to cover, some new type of prenatal screening for every mom, that would be, I would think, the first question you're going to get, especially maybe from more fiscally conservative Republicans, is, do you have a cost analysis? How much is this going to cost Medicare each year? This is not really like that. There are some grant monies in here, but they're discrete cost. It's a 20 million, and I don't have, we can, if you wanted to, Crystal, to pull up that page, I did not, I thought numbers might get boring, so I did not put them in my notes, but it's like a 20 million grant program for telehealth. And I think a 50 million grant program for coordinated care. So those costs are discrete and listed in the bill, as opposed to something that's ambiguous, and might be impactful later. So I think those upfront costs are clear. And so for this particular bill, you wouldn't have it. And I'm looking, so yeah, the telehealth program is 10 million. And then The coordinated care program is 50 million. So then that cost is a pretty, clearly stated $60 million cost. And I don't think that's going to be your first question on this bill, but I suppose it's good to come with all the facts.
Okay, fantastic. Thank you.
Yeah.
Very. All right. Does anyone else have questions for Katie, or is there anything else about the bill you'd like to touch on, Katie?
There's nothing else about the bill. I guess I would just encourage, if you have any questions, I know we do have some folks who have really done this before, but if you've not done this before, if you have questions about how this meeting might go, other thoughts, what questions might they ask me? I think this would be a great time to ask those questions too. So it does not have to be bill specific. It can be anything related to these meetings. And the one other thing that I will share is sharing your personal story can be very, very important and impactful. Again, you are a constituent. You are a mom. If you're a member of Mom Congress, I'm guessing. So if you have been affected by a lack of access to care, if you have been affected by not having access to a telehealth service you need, those are themes I think that can be really impactful during these meetings. And Alexia has a question.
I think you were kind of starting to hit on it too when you were discussing sharing your own personal story, but I was just wondering, for those who maybe, I'll just say, for lack of words, novice at this, right, going into the space, do you have any sort of template of things, ideas that you want to keep in mind that may exist, especially as Mom Congress members, that you can use if you are preparing for this type of dialogue? Like, what are some things you want to keep at top of mind? Like you said, sharing your own personal story, understanding the data for your state, things like that could just be helpful.
You are a seasoned advocate, I can tell. So yes, it's sharing your story, and it can be anything that you have that relates to this. I have been fortunate enough, and be very honest, to have great access to care during my pregnancies, but I was doing some advocacy around accessibility of heparin. And I talked about how having, my ability to do heparin injections at home allowed me to have a successful pregnancy after 2 late-term miscarriages. You can look at my legislator and say that, access to that medication in my home allowed me to have a baby after losing 2 babies. And it just is different when it's coming from you and it's your experience as opposed to quoting some sort of statistic. So I think it's personal to you. It's what's your experience. And as much honesty as you're comfortable sharing with your legislator is a good thing. And in addition to your personal story, yes, it's facts from your state. If you live in a maternal care desert, which if you're from a rural area, you might talk about that. If you've experienced discrimination, talk about it. If you haven't been able to access the care you need, or you have a friend or a family member, talk about that. Those are all really, really meaningful. I think there's some things in the chat here I'm just going to turn to.
Yeah, I can read those out for you, Katie, and just want to say thank you very much for sharing with us.
Yeah.
Very, very kind of you to share, and we hold space for that for you.
Oh, thank you. Wow.
Heather asked about, is this for both health and mental health care?
Mental health is not called out in this bill. We do have a bill that we're working on that is not Healthy Moms and Babies around mental health care, but it's also not stated that funds shall not be used for mental health. So I suppose it could be a part of the, they look at the part of the bill that's talking about looking at the health of the entire mom. I don't see why mental health would not be an included part of that.
Okay, great. Thank you. And Jill, you asked about Midwives for Moms, and we are going to do a training on Midwives for Moms, independent training, and that invite should come out to you. I think it's going to be in the middle part of next week. So you should see that in your email soon. And someone else sent a chat question here. I'm trying to go back up and down, but there was a question about if you're not coming to DC, or if you're coming to DC but also want to advocate in your district or take a virtual meeting, yes, we are offering support for that. So these trainings for all of the Moms Agenda bills are open to all Mom Congress members. And I'm going to go right now and go grab a link for you where you can register to share that you're interested in taking an in-district meeting. We're setting up supports for those in the second week of October, just kind of aiming for when the members are back in district. And then we're also offering support for if you want to have a Zoom meeting, if you're not able to go physically be in person with them. So I'll put that Google form link in the chat in just a moment. And it looks like Becky is raising her hand.
Yes, I have a question that's not necessarily related to the bill, but about meeting with our Congress members. So the question is last year was my first time at Mom Congress, but we were still meeting via Zoom. So I think that what kind of time frame do we expect to get? And does it, I guess, does it depend on each Congress member or the staffer, or in the past, what have you seen as far as how much time we get to really talk to them and go over the bills?
So I would, in my experience, and Crystal may have some more logistical details, so I'll let her chime in, but, those meetings are usually 30-minute meetings. And if a staffer, I'm always prepared for a staffer to be running late, things come up. So, I think if you can get, I always say, if I can get 10 minutes with somebody to share my story, my message, why this is important, that's great. So I would say you probably would get a 30-minute meeting. And be prepared for that meeting to potentially be a little bit shorter than that 30-minute window, but that's pretty standard.
Thank you. Yeah.
And I also, Crystal mentioned the Zoom meetings. If you are not able to do, I know some folks may not be able to come to Washington for a whole multitude of reasons, especially if you're a mom. Those Zoom meetings are incredibly effective too. So I want you to know, that sharing your story, doing that Zoom meeting, taking the time to meet with your legislator virtually can be just as impactful. So, not to shy away from doing that.
Yeah, Katie, all I was going to say was Katie's the person to answer this question because, all of those meetings. The only other thing that I was thinking of when you said that being lucky to get 10 minutes is just throwing it out there anecdotally. Don't be surprised if you have to take a meeting in a hallway or in a spot that doesn't feel particularly private. You may be standing kind of in the entryway to an office. It just kind of depends on what's going on. And I've seen all of those scenarios that I just mentioned happen during an in-person meeting, which was still incredibly impactful. And the legislator still signed on as a co-sponsor and we got the win in the end. But it was, I have to admit, the first time it was a bit jarring to me. It was like, oh, we're going to stand in the hallway. Like I flew all this way and now I'm going to stand in the hallway, or now I have to meet you virtually because there's not an escort to take me in, which is not going to happen this year because the Capitol is fully reopened. But just sort of some of those things that can take the wind out of your sail a bit when you're walking into a meeting. But yeah, 10 minutes is a great window of time to get. And that's why preparing yourself in advance, coming and learning about the bills and preparing your story will, give you the leg up that you need to go in and be really impactful in a really quick manner.
Yeah, Crystal's totally right. There's nothing wrong with a hallway meeting. I have also done a hallway meeting. And it's because, and you'll see this when you go in, a lot of these congressional offices, especially on the House side, they're not big. And so if your member is in their their office, they already have one constituent meeting in there. It just may be a little more conducive to be out in the hall, but it's not in any way a reflection of you or your messaging. It's just the constraints of being on the Hill. So that's a great point, Crystal. Thanks for bringing that up.
Thanks so much. Thank you. Well, that was fantastic, Katie. Thank you so much. I'm going to offer one more quick pitch to everybody who's on the call live today. And if you're watching the recording here before the DC Hill Day, Ebony is, thank you so much, sharing a reminder that if you have scheduled your House of Representatives meeting, please go ahead and send us that information in the meeting log here. All it's going to ask you is, have you secured a meeting? If so, who are you meeting with? What's the staffer's name? All that sort of stuff, so we can help prepare follow-up information for you. I'm going to go ahead and turn off the recording for now, and I will remain available for a few more minutes if anybody has questions.